Good afternoon, everyone, and a warm welcome to this session. My name is Stefan Klose. I'm a postdoctoral researcher at the Brussels School of Governance, which is part of the Free University of Brussels. I'm the moderator of the session as well as a speaker, so there's a clear conflict of interest, which I'm trying to navigate throughout the session. This session is very confidently titled Evidence-Based Evaluation, a Key Step Forward for PCVE Policy and Practice. Let's see if that confidence is warranted, or if at the end of the session we might want to add a small or bigger question mark to this title. So we're going to discuss the subject together with three speakers. Unfortunately, one of them is not yet able to join. That is Ruth Bermejo, Associate Professor in Politics and Public Policy from the Juan Carlos University in Madrid. That's due to some technical difficulties. We hope that we can resolve those very soon, and she can join us in a few minutes. We will see whether that's possible. Ruth, I can see that you're here. So I hope your microphone is working. We also are joined by Gaspar Sanz, who's director of PVE Works. And we have with us Eileen van Leuven, who's a research fellow at the ICCT. We received some guidance from the organizers, and those tell us that we should take a maximum of 10 minutes per presentation. And I will try to set a good example by going first, which is also, I should stress, a choice of the organizers. This is not my decision, but I think there's also a rationale behind that. And so far as a work package leader in the Indeed project, I have dealt with this concept of evidence-based evaluation for a while, and what I would like to use my presentation for is to give you a sense of what we mean by the term. Now, I'm going to open my presentation. To all participants, if you have any questions that come up, please post them in the chat and use the Q&A function. We will do our best to respond to all comments after our initial opening statements. So we go through those first, and then we'll hopefully have a good interactive discussion after that. This whole session is from 3 until 4:30, so we should have enough time for a good conversation. All right, so I'm going to open my slides in the hope that you will be able to see them. This will take just a second. Okay, so here are the slides. I hope you can see them. I can. Then let me start and take 10 minutes from now on. So, as I already mentioned, I'm the leader of one of the Indeed work packages, that is work package 1, which deals with the conceptual foundations of our project. And as you already heard in our sessions earlier today, one of the key concepts for us is the term evidence-based evaluation. And what I would like to do in this presentation is to give you a clearer understanding of what we mean by the term. That term is guided by a set of key principles, which I'd like to outline briefly, and then I want to reflect a little bit on the potential that I see in evidence-based evaluation, but also note a few limitations to this approach. And basically, I want to follow up a bit on the conversation we had earlier and set us up for maybe a more detailed conversation about evidence-based evaluation in this session. So you heard another term earlier today, which is evidence-based practice, and evidence-based evaluation draws on that term, evidence-based practice. And that term was first developed in the early 90s in the field of medicine, so has already quite a history, has become very popular in that field of medicine, and has since the early 90s also gained popularity in many other disciplines in the social sciences, particularly all disciplines related to public services such as social work, education, public health, criminology. There are different definitions of evidence-based practice, but in the early 2000s, in a number of disciplines, there has been a consensus, or consensus has formed around one definition, which is an understanding of EBP as a decision-making process which integrates three elements. The first one is available external evidence, the second, professional expertise, and the third, client or stakeholder values, preferences, and circumstances. And the idea here basically is to illustrate that a little bit. If you go to a medical practice and see a medical professional, then ideally you would like that medical professional, as they examine you and think about treatments for your illness and come up with a diagnosis, you want that medical professional to be aware of the latest research and the best evidence out there about the efficacy of potential drugs that could help cure your illness. You would also want that medical professional to be aware of side effects. A second thing you would like that medic to be or to know is you would want that person to have very good clinical expertise and strong professional experience as they make their judgment. And thirdly, you would like them to take you seriously as the patient, as the client, and consider your personal circumstances, your preferences, your values as they decide on a treatment for you. And basically, our idea in this project has been to apply the same logic of evidence-based practice to the field of evaluation. So evidence-based evaluation in our project is defined as a process of planning and implementing evaluation which integrates these same three principles: available external evidence, professional expertise, and stakeholder values, preferences, and circumstances. So here the idea is that the evaluator should build on available research on the topic that is being evaluated, as well as research on evaluation practices and methods. In the process of evaluation, we want that evaluator ideally to have specific expertise in the field of evaluation, professional experiences that can be brought to bear. And we want the evaluator to take key stakeholders seriously, to involve them as much as possible and engage them in the evaluation process. And that is also something that we already touched upon, I think, in the previous sessions. Now, a few points about the potential of evidence-based evaluation. So first of all, there is the assumption that evidence-based evaluation can promote a more rigorous evaluation process by highlighting the careful consideration of available research on research methods and on the topic under investigation. A second potential benefit of EBE is that it can promote a more ethically sound evaluation process, which is more reflective of stakeholder interests and suitable to organizational learning by involving stakeholders at different stages of the evaluation process, in the planning, in the implementation, in the follow-up. And a third potential benefit is that it can provide a catalyst for closer cooperation between communities of research and practice, another point that was flagged earlier. And under ideal circumstances, it can even help to strengthen the uptake of evidence-based practice by practitioners in the field. So the logic here is that evidence-based practice provides the foundations for evidence-based evaluation, the rationale, the key principles, and in turn, evidence-based evaluation by including stakeholders can also generate more interest in evidence-based practice. If stakeholders are involved at various stages of the evaluation process, then perhaps also the chances that they are going to follow up on evaluation results and use them in their daily work may be higher. Just a few additional points on what evidence-based evaluation is and what it is not, to avoid confusion. So evidence-based evaluation should really be seen as a very broad framework for evaluation practice, which is based on the key principles that I just identified. And it should be seen as an approach with a wide applicability, which goes beyond the narrow field of PCVE. So this is a framework that can be used across different disciplines. And it's important to strengthen that this means also that it is not wedded to one particular evaluation method or design. So evidence-based evaluation is not a particular type of impact evaluation or process evaluation, but rather a framework that can help us to implement these different types of evaluation. Right? So an impact evaluation can be evidence-based and can be non-evidence-based and so on. The same goes for methods. As Kai also mentioned earlier, evidence-based evaluation does not prescribe one method or favor one method over others, but is an approach that is open to different evaluation methods. And the last thing which I think is important to clarify is that this is not necessarily new evidence-based evaluation, in the sense that there may be practices out there already that can be clearly identified as evidence-based evaluation, at least to some degree. And in so far, it might sometimes provide us rather with a term to describe or identify practices which have already existed for some time, but it's not to say that there is no evidence-based evaluation out there so far, and that this is only something which we need to develop still. And finally, about the limitations of evidence-based evaluation. So there are a few challenges and quite significant ones to the practice of EBE. One notable challenge is the often insufficient allocation of time and resources to the evaluation process. That makes it difficult to have enough time to review available research that matters to the topic under evaluation properly. Also makes it difficult to sufficiently involve and engage stakeholders at different stages of the evaluation process. More specifically to PCVE, we also have the problem of the sensitivity of data, which again can make it difficult to involve stakeholders in a rigorous way. Also makes it difficult to involve external evaluators sometimes, which in turn creates problems when we think about an evaluator's expertise or experience. And then finally, we have the more general problem that the evidence base, both in PCVE and in evaluation research, is rather slim. So we know very little at this stage about how to engage stakeholders well. There are few studies that give robust answers to the question of how we can best engage stakeholders at different moments in time. So there is also a need to invest in those types of research if you want to move forward with evidence-based evaluation and strengthen it. So there are a number of challenges ahead, and I would like to end by just pointing you to some sources for further information. As part of the Indeed project and part of Work Package 1, I wrote a longer report where you can find much of what I just said in more detail. You can find that report on our website. And tomorrow we're going to have a session where we will describe our own evaluation tool, which builds on the principles of evidence-based evaluation that I just described. So if you want to understand how we took this concept of evidence-based evaluation further, then you're very welcome to join us tomorrow. Okay, I'm going to leave it here and hand over to our next speaker, which according to our guide should be Ruth Bermejo. And unfortunately, I think her microphone might still not work. Let's just check quickly with you. Yeah, I'm very sorry, but we cannot hear you, which is really unfortunate, because be very interested to hear what you have to say. Maybe you'll be able to answer or ask your questions in the chat to our presentations, and perhaps also engage with some of the questions that come our way. So hopefully we can, involve you in some way. I'm very sorry that that the microphone does not work. So then let's head over to our next speaker. I guess the positive news, if any, is that we can be a bit more relaxed with the time limit. The next speaker is Gaspia. So I'm going to hand over to you. Take 10 to 12 minutes for your opening intervention, and looking forward to hearing from you.
Thank you, Stefan. I'm just gonna take the share screen option so I can put up my presentation for everyone.
Excuse me, can you hear me now?
Oh, yes.
Don't worry, go on.
We can.
I will
I'm very happy to hear your voice.
I'm happy to let Ruth
I will
go
follow.
First.
Okay, perfect.
Ruth, why don't you go first, since it's working?
No,
in case it
don't
slips
worry,
out
go
again.
on.
Are
I
you
have
sure?
to upload my presentation and all that, so go on, please.
Thank you very much. Then I'll go ahead. So thank you, Stefan. And it's really an honor to participate in this forum. And let me also thank all the organizers. And good morning, good day, and good evening to the audience. Today I will be presenting on measuring without numerical values, a practitioner's perspective. As your presenter, let me introduce myself. I'm Gaspia Essence. I am the director of PVE Works. Please feel free to connect with me via LinkedIn. I have 15 years of experience in counterterrorism and countering and preventing violent extremism in fragile and conflict context. It's important for me to also mention I'm not a monitoring and evaluation specialist, but as a program manager and a project leader, I have had to face the rigorous demands of M&E. With that, I would also like to offer a brief overview of the presentation. We have already covered the introduction, so that's good. And then we've got a few more sessions, sessions 2 and 3, on Afghanistan and Cameroon. I will provide a background to each context and the M&E landscape, and then I will follow up with the results of complying or not complying with the M&E standards with numerical values. And then I'll finally conclude with as a practitioner working in violent extremism. So straight into it, Afghanistan. The Afghanistan Reconstruction Trust Fund, ARTF for short, is managed by the World Bank. It has a total funding of $6.3 billion US, and it's a multi-sectoral focus. The rigorous reporting and tracking at the project and portfolio levels. At the project level, and this is very typical of all World Bank projects, you have 2 levels of reporting. You have the implementation status report, which is a report that provides an update on the project results, disbursement status, and overall implementation and ratings of the project. And the second process that is very typical in World Bank projects are the implementation completion reports, the ICRs. Now, this is the end of project evaluation. This basically takes the project objectives and compare and contrast it with what was actually delivered to see if the World Bank actually delivered on its final objectives. Now, the Afghanistan Reconstruction Trust Fund, the M&E process around that was created from scratch, and I'll go into this a little bit more. But I should probably also mention before that, the ISRs and the ICRs are publicly available documents on the project pages of the World Bank website. So at the portfolio level for the ARTF scorecard, there's a scorecard. It's an annual results report that highlights the ARTF's overall performance. The ARTF results matrix, on the other hand, provides a mid-year synthesis of project-level results for the ARTF portfolio. So Pillar 1 talks about Afghanistan country-level outcomes. Pillar 2, which looks at the ARTF project and program-level outputs and outcomes. And finally, Pillar 3, which is the operational and organizational effectiveness. Now, these three pillars represent the varying and competing demands of donors. Now, one of the, okay. Now, in the context of Afghanistan, and in 2011 to 2014, when I was physically there, this level of demand for data was difficult to obtain for a number of reasons. A, collecting data, and particularly for women, was challenging due to local, social, cultural constraints. B, traditional paper-based survey techniques was challenging due to logistical and security challenges. The cultural sensitivities around male-female non-family member interactions were and are still prominent. And with a limited number of female data collectors at the time, it proved even more challenging to collect hard data, to actually get, high-level data. And finally, surveyors were often targeted if they were seen carrying government documents. So what do we do when the numbers don't exist? So in my context, my teams and I did two things. The first thing we did was we used digital devices. This is cell phones or tablets to engage with participants. We created an interactive medium to collect data. We focused more on behavioral changes in communities' perceptions to better understand what works, what doesn't, what's needed, and where to improve. This led us to recalibrate the lack of numerical data by understanding the impact of projects through results stories that support the visibility and effectiveness of the ARTF-funded projects. We opted for qualitative information for positive and effective feedback. This is also in line with my experience in Cameroon. So on this slide, I want to point out that there's 5 data points. Now, I point that out because I really want to show the difference between having a narrative versus data points. And in both, you'll find the information is rich, so I'm trying not to skew the information, but I really do hope that during the question and answer part, we can get some feedback and discuss this, because, that's what we're here to do. But basically, let me continue. So the Voices for Peace program, it aims to amplify moderate voices of peace and tolerance in West Africa. The total funding is $24.9 million from USAID, and the geographic focus was Burkina Faso, Chad, Niger, Northern Cameroon, and Mali. The implementing partner was Equal Access, and the time frame and duration of the project was from September 2016 to September 2021. Now, for the narrative part, or before I get there, I should probably mention that I was only responsible for the Cameroon portfolio. So when I talk about Voices for Peace here on forward, it's really in particular to Cameroon. So the Voices for Peace was a community-led radio program that aimed to reduce vulnerabilities to extremism by amplifying local voices and encouraging dialogue to strengthen community resilience and mitigate the threat of violent extremism. The Voices for Peace program had 16 partner radio stations, broadcasted in 26 local languages, and used social media to reach a larger audience to empower local communities to identify drivers of conflict. by leveraging cumulative historical and cultural traditions of tolerance and moderation. Now, for me, I feel both data is good, but there's a clear winner for me, because then you connect with what the project is doing and you connect with the communities on the ground. We'll discuss that later. Going straight into the M&E for Cameroon, Voices for Peace focused on producing and broadcasting radio programs on themes of preventing and countering violent extremism, tolerance, peace, good governance, and human rights to build community resilience in Boko Haram-affected communities. Voices for Peace had a content advisory group which served as a feedback loop mechanism to inform radio station content and messaging. However, in terms of M&E, listenership surveys were conducted and used as a measurement to identify the effectiveness of PCVE activities. Now, while the survey results indicated Voices for Peace partner stations have a large audience size of around 6 million people in the 5 countries, listenership in radio programs do not tell us if there's effective PCVE impact. Reach and awareness are nice and good, but this alone does not result in preventing or countering violent extremism. Of course, these numbers sound excellent to the donors and stakeholders wanting to see progress, but these numbers simply do not measure either impact or results. Again, faced with numerical values that did not add up, I had to look for solutions. Having had the experience in Afghanistan, it helped me to adapt to the context by reframing the feedback loop mechanism, which my teams and I used as a built-in M&E structure to better understand the effectiveness of the project and perceptions of change within communities. By recalibrating the available data, we were able to report on stories of resilience from community members and understood very quickly that the impact of community resilience is felt and therefore intangible. This resulted in real-time feedback from the ground for more targeted interventions. So, in conclusion, we can learn from these lessons in the following ways. First, both these experiences in Afghanistan and Cameroon underscore the need to put the social back in social science. It helped us determine what is feasible or not in fragile and conflict context, especially when there's a moving target, the urgency of now is yesterday, and the data is hard to come by. These approaches that involve narratives and success stories that provided real-time feedback directly to donors allow donors and stakeholders to see the meaningful impact on communities that benefited from the project through their own voices. And for communities that did benefit, they guided the projects to truly address the community's needs. Finally, this feedback loop of involving community inputs also allowed for built-in flexibility and innovation to adapt to unfolding implementation challenges in rapidly evolving contexts, such as violent extremist context. Finally, thank you, and I'm very happy to take any questions. Also, please feel free to use the QR code to learn more about PVE Works.
Okay, perfect. Thank you so much, Gaspia, for that very insightful presentation. And I think it followed up very nicely on the call to involve stakeholders more in evaluation. So I think you've given us a great example of what that stakeholder element of an evidence-based evaluation can look like in practice. So next we're going to turn to Ruth, who miraculously managed to have the microphone work, and I'm extremely happy that she can join us with her voice. Ruth, the floor is yours.
Hello, everyone. It's not a miracle. It's just that I was doing something wrong. So I just have to tell you that. But I'm very happy to go behind this marvelous presentation about concrete cases of evaluation. And in my case, I want to talk about the evaluation we did for a European project on the implementation of PCBE policies. Before talking about that, I would like to remark some things some very important ideas that have been shared since the beginning of this conference. And that for me, as we can say, academic or theorist of public policy analysis and evaluation are key in when we develop evaluation and when we work on this on the evaluation of PCBE in concrete. One of the ideas that I would like to remark is we need to learn from what is working and from what is not working. It's been said in the previous session, but I think is very important because part of our work in this project was to see or was to analyze why the policies designed for preventing violent extremism and radicalization were not working. So our main focus was to know what were the main problems, the main obstacles, and why they were not working as expected. And the second one is about the technical language, the technical apparatus or conceptual apparatus that we are using. So that's something that we can, as analysts, we can work with that, but is not, in my opinion, is not incompatible with some of the ideas that have been also shared, like in the previous presentation about qualitative methodologies and involving all the participants and ethical evaluation. So I think both concepts, the technical one and the participatory one, had to be, I think, could be complemented in evaluation. And the third idea is about evidence-based evaluation, as you were saying in the beginning. When indeed began to think on evidence-based evaluation, and we began to think on that, the question is there any evaluation that is not evidence-based? And for me, the idea in the Indeed projects and in other projects are also in the methodological aspects of evaluation is that we always have used evidence for evaluating. Otherwise, there's no way to evaluate a public policy. But the type of evidence or the mixtures of the panoply of evidence that we can use is more broader, is broader than the one we were using before. So for me, the concept of evidence-based evaluation has more to do with what is that evidence that than the idea that in the past we didn't use evidence for evaluating. Just some ideas, because I know we can talk about many things later, and I would like just to share some ideas about the evaluation we carried out and that give us some recommendations for different levels of government. We evaluated PCBE policies, and in different countries, in Tunisia, in France, in Spain, and in Portugal. And we, after some reflections, we provide these recommendations. And the first one could be that most of the countries in Europe were following European guidelines, but they were not really tailor-made in those guidelines to their context. I think this is not new, but when you think on your application or your translation, we can say, of a policy, you have to take into account your context, and guidelines can be directly, in most of the cases, applied because you have different administrative systems, you have different cultures, different social networks. So that's one of the first ideas we had when we did this evaluation of different countries. Um, um, we carry out those evaluations in many places. You are seeing there where we work. Mainly, we did the evaluations through surveys and also through discussions groups and with in-person interviews. And all Salzburg was part of the evaluation, but not of the final report. That's why I didn't mention Austria before. But as you can see, we work in Spain, Portugal, France, and Tunisia. As I was saying, we had the guidelines, the European guidelines, but we need to concrete those guidelines in the different contexts that we had. And we found some problems related to the politician support for these local policies. A second point, as you can see, there are problems related to policy design. That as I was saying, there was insufficient attention to the national context, and we also found problems related to implementations. I would like just to highlight this part because we found that there were networks of actors in the idea of multi-agency incorporation, as also has been said before. But those networks of actors were not formally structured. They didn't know very well how to relate with each other, or what was their role in the policy. There were also policies problems related to vertical and horizontal coordination in the policy of preventing violent radicalization, and also, as I think it's one of the main aims of Indeed project, we found that there was insufficient training for professionals involved in the prevention of radicalization. So this is one of the key points of Indeed, and I think that's something we also show in the past. And also, we found that there was an inadequacy of institutional communications, no clear ways of communicating or about the information they had to share between the different actors involved in the policy. Just very briefly, because I know that we don't have a lot of time for this, but we can go back whenever we want. Particularly for local governments, we talk about that part that has also been highlighted about including all the actors that had something to do with that. Most of the time, the implementers had not been consulted in the definition of the problem or in the identification of the policy, and also the design of that policy. So it was very difficult to persuade different actors to get involved in that. This is also the part of the communications problems, as I said. So I think those are the main idea, and we can stop our contribution here. And we can, if you want to us to share something else, just tell us. Thank you.
We can't hear you, Stefan.
No, Stefan. I thought it was me. Now.
Can you hear me now? Okay, perfect. That was just to say that we're now moving to Eileen, who is going to give the final opening talk. Over to you.
Great. Yeah, thanks a lot. I will quickly share my screen with you. Let's see. Somehow that doesn't seem to work anymore. I just tried it.
Did you try to share the screen or to upload a PDF?
No, I'm trying to share the screen, but it doesn't give the screen options. So that's a bit strange. So what I don't know what I can do now. Maybe
do you have the option to upload a PDF instead?
I could try that. Yeah, I have the option. So the problem is that it doesn't show the windows that my computer has open, so I can't go to the PowerPoint. But I'll try with the PDF version, and otherwise, but then I have to upload a PDF, which also, it does work, but it doesn't show the right option. So I guess you will have to do without a presentation, which is unfortunate, but yeah, I can seem to make this platform work. Thanks so much for having me at the Indeed conference. And it's really a great pleasure to be here and to present on a forthcoming publication that I'm co-authoring with Amy Jane Giele. She's a Dutch M&E expert. And the title of the publication and the presentation today is Debunking Misconceptions About Monitoring and Evaluation for CT and PCVE Programs and Policies. The research is based on the evaluator experience of both Amy Jane and myself, and the existing literature on this topic. And today we will discuss 4 misconceptions that surround M&E in the CT and PCVE field. And they are mainly prevalent among some of the policymakers that we encountered during our work, or practitioners. So it's like a lot of the common misconceptions that come up when we talk about M&E to people who have not worked with it a lot previously for their work. So for each of these misconceptions, we'll go back to the underlying challenges and then offer some good practices on how to overcome these challenges. I will try one more time if I can upload the presentation, because then you can see. Now it gives it to you guys. So you'll be able to see it now. Is that correct?
We can see it.
Great. So, problem solved. Misconception 1 is that prevention and non-events cannot be measured and evaluated. The purpose of evaluations is often seen as proving that violence or radicalization would have happened if there had not been an intervention. And success is often defined as the absence of a harmful event. So this is one of the most prevalent misconceptions surrounding M&E in this field, and is often cited as one of the reasons why M&E cannot be done. But we argue that M&E can be done if we define success more specifically. So first, to debunk this misconception is that we have to look at the challenge underlying this misconception, and that is to establish causality and attribute specific outcomes to the measures undertaken. So as all of you know, violent extremism and radicalization are very complex phenomena, and they are influenced by a multitude of interrelated factors that often go beyond a program or policy. So it's very hard to attribute a particular change to a particular intervention. So how can we overcome this challenge? First, we can do that by creating a theory of change, or a TOC. This clearly outlines how an intervention aims to bring about change and which risk factors will be influenced and how. This makes a theory of change a good basis for an M&E approach, as it provides a specific theory that can be tested and specific changes that can be measured to indicate progress. So rather than focusing on the final long-term result, a theory of change helps to break down the desired outcome into measurable subcomponents. But this theory of change does not directly solve the problem of causality and attribution. So that can be overcome by focusing on the contributions rather than the attribution. So it is possible to measure causal links through evaluations that have experimental or quasi-experimental methods, but most of the time that's not feasible or suitable to the context. So what we can do in that case is focus on the contributions of particular interventions to the changes that were envisioned in the theory of change. This approach is advised when evaluating interventions in very complex environments and contexts like the CT and PCVE space. Then misconception 2 is that concepts are too abstract to be measurable. Well, the underlying challenge here is that there is a lack of agreed upon definitions and that there's no clear set of practices, methods, or standards to evaluate the impact of PCVE measures. These two challenges make it indeed hard to operationalize concepts, formulate indicators, and design data collection methods. So how can we overcome this challenge? First of all, we can work towards a shared understanding within teams and institutions at the start of an intervention, policy, or program. So rather than waiting for the entire CT and PCVE field to agree upon a shared definition on, let's say, resilience or deradicalization, we can sit together with the team or the representatives of institutions and define these key terms and the key aims of the interventions and the programs among the team that's working on it. Then from that shared understanding, we can develop smart indicators in the design phase as well. So indicators help to break down complex phenomena and the theory of change that was previously identified into measurable components. And these can then be measured through existing questionnaires and measurement tools. The PCVE field actually has quite a lot of tested tools that can provide standardized measurement approaches and can help capture changes in attitudes, beliefs, and behavior. So using these tools as a basis can be very helpful, and then these can be applied to the different contexts of the intervention. Then we have misconception 3. And that is that M&E of CT and PCVE interventions is too politically sensitive. The underlying challenge here is that the nature of these interventions are too sensitive, and that coupled with heavy media scrutiny, that there's an atmosphere of caution and hesitation among policymakers and practitioners to conduct M&E. This perception of extreme political sensitivity is hindering robust M&E efforts, and it can lead to missed opportunities for evidence-based decision-making and proactive policy improvements. So it sounds quite counterintuitive, but the good practice here is proactive transparency and communication with the public and the relevant stakeholders. So we have evidence of evaluations that were politically sensitive and that were conducted by institutions who were already under significant media scrutiny at the time. But when they made their evaluations publicly available, they actually didn't receive significant media attention or public backlash. This shows that evaluations can be beneficial despite the political sensitivity, and especially because evaluations also show positive results. And open communication about positive results is shown to increase public trust in institutions. So the good practice here is to embrace proactive transparency and communication to the public and key stakeholders. Then the final misconception, number 4, This often emerges as a common argument for not conducting M&E or evidence-based approaches to CT and PCVE, and that is that we don't have the time. The underlying challenge here is that M&E is seen as time-consuming and an extra to-do on top of the already heavy workload. This perception creates a barrier to evidence-based decision-making and hinders the integration of M&E into program and policy implementation. There are several ways to overcome this challenge, and the first one is strategic planning and resource allocation. We have evidence from policymaking entities that invested in M&E that conducting M&E efforts regularly actually saves time. So it doesn't add time, it saves time. Particularly when, for instance, policymakers receive a lot of questions from management or parliament, it saves them time because they have this information at hand through the M&E systems. So another good practice is to work with external M&E experts if needed. Outsourcing M&E obviously saves time internally, so this is an option as well. The third good practice is that M&E can help capture institutional knowledge. We know that many institutions have a quick turnover of personnel and people change roles a lot. And M&E can actually play an archival role by documenting what has been done. And subsequently, by systematically documenting these results and lessons learned, stakeholders can build accessible institutional knowledge over time. And finally, we have the proactive communication. Stakeholders can further reduce the time burden by engaging in proactive communication about evaluation results. Making evaluation findings publicly available and sharing them with relevant parliamentary bodies or journalists can minimize the need for repeated inquiries. So besides this, it can also demonstrate a commitment to accountability and evidence-based decision-making, which subsequently fosters public trust and support for CT and PCVE efforts in the future. So this is all to say that the misconceptions in CT and PCVE and the M&E surrounding that, they originate from real challenges, and these real challenges can be overcome by implementing certain good practices. So thank you so much for your attention, and I'm happy to answer any questions you may have.
Okay, perfect. Thank you so much, Aline, for that presentation. And you can say we're all looking forward to seeing that publication that you're working on. That looks very exciting. So we are now in the fortunate position of having 35 minutes for discussion, for questions and answers. Unfortunately, at this point, I do not see any questions in the chat or in the Q&A. So this is a call to all participants who want to get involved, to start formulating your questions. I hope you all are aware of how you need to navigate this tool. There is a button to the left, to the right of the screen for the Q&A, and there's another button for the chat. You can use either. You can also use you can raise your hand if you like. That's another method. So we have a number of ways in which you can ask your questions to one or several of the speakers. And perhaps while you're formulating, let me already ask a first question. This is one perhaps primarily to Ruth and to Gasbia, who have acted as evaluators in really interesting capacities, and it was very interesting to listen to both your presentations. As I mentioned in my earlier talk, like two of the key principles of evidence-based evaluation are that on the one hand, stakeholders should be involved at every stage of the evaluation process. And the second would be to draw on existing knowledge about evaluations, existing research on the subject under investigation. And I'm wondering how in the evaluations that you were involved in, you were experiencing these 2 points as a challenge. Like, was it difficult for you to involve stakeholders properly? What were the main limitations that you faced in that? And maybe if you sort of reflect on that critically, is there something you feel that you could have done to improve this further? Do you have any sort of recommendations for others that's derived from your work? And the same when it comes to drawing on existing knowledge. What kind of limitations were there when it came to, building on evaluations that are already there in the field? Like, what are the limitations that you found there, and what do you think needs to improve to move a step further towards, evidence-based evaluation? Maybe I can give the two of you, there's a point in the Q&A, I feel, so let's maybe bring that in too. You can see, I think, also the Q&A button, all the speakers. So there's a question from Heidi. Let me quickly read that one out. Results of my PhD thesis show that some exit program providers do not monitor or evaluate impact of their work because they do not trust standardized tools or methods out there. How can we overcome fear or mistrust towards tools and practices? Is there someone who would like to go first?
I can maybe quickly reply to the question.
Yes.
So it's very interesting. Thanks so much for sharing the results from your PhD thesis. I would be really interested to hear why they do not trust these standardized tools or methods. So because only then I think it's possible to see where this fear and mistrust comes from. What I can see, like some of the reasons could be that it's too technical, so people are a bit scared if they see a lot of technical tools. But if that's so, then I would say like there are lots of different works from evaluators who have already contextualized certain tools. So through some research, it's possible to see how others have applied it, or working with an external M&E consultant, for instance, who can help contextualize the tool for their work. But if the fear or mistrust is coming from the fact that I don't think it works, then obviously that is hard to show if people don't look into it themselves or don't ask for any help. It would be interesting to see what the reason is, and then to think about ways how to tackle that, and how to make these tools more applicable for exit workers.
Stefan, I wouldn't mind responding a little bit to the last question, actually, and it actually
go
goes
ahead.
back to Eileen's presentation. And one thing she stressed twice in her presentation was to practice transparency in communication. Maybe, and I understood the question a little differently, maybe there was a lack of transparency and or proactive communication that makes that creates distrust or mistrust. I don't know. I just want to add that to the conversation. And then to add the question to add to the response on your first question about stakeholders and drawing on existing knowledge and what's the limitations. My experience for limitations for both cases was it's really hard to get numerical data. How number of trainers is not telling me if we're actually doing preventing violent extremism. It's not telling me if we're building community resilience. It's not letting me know as a project manager if I've done successfully what I intended to do. So one of the things that I was able to do in Afghanistan was actually work with donors. And that's one of the biggest insights was to work with the donors. When donors would come with all these competing demands, we had to find solutions to make it work, including, this is back in 2011 to 14, let's add gender to the ARTF agenda. Well, in a context like Afghanistan, when there's no visibility on women's prospects, it's hard to say, let's give them jobs. So how do you do that, right? So you have to find avenues that speaks to both the donors, the client countries, and the community. So something that actually helps them. And this was something for me I found most useful, and I was able to apply it also in Cameroon. So in Afghanistan, when I was tasked with this opportunity or this job to let's find gender inclusion for transport projects, and the easiest fix is, let's put women with job titles. And I said, no, this is not an option. It's been 25 plus years that women have not been educated. What type of jobs will they have? So I started looking at the different aspects of how men and women travel and trying to survey this capacity. Now, when we realized that men and women travel differently in Afghanistan, men were using roads that were well paved, well lit, and it basically went from residential areas all the way to industrial areas. So they were working, and they had nice buses that could take them there. Now, when you looked at the roads that women were using, the roads were not well paved, they were not well lit, they were, for lack of better terms, very shady. And in the context of Afghanistan, this creates levels of insecurities for women and gender-based violence with honor beheadings, right? To preserve the family and all these types of issues. So the idea was to use data in a way that would support women. So when we looked at where women were traveling and we saw this, the idea that stuck with the government of Afghanistan at the time, with the community, and with the stakeholders was, oh my gosh, we're actually going to do gender inclusion by building real roads. And this was the type of process that I don't think you can get to this process without actually putting a meaningful process on it, without thinking about how you can use the data to help, right? And in the context of Afghanistan, when we were not getting data from women, this was also providing basically a platform where they were excluded completely. Now, for me, those were the limitations, and you kind of have to find a nice way to bring all parties together to consolidate all those messages and basically repackage it. And I'm sure you've done this so many times in your own careers that, you bring everybody on board with a message that can resonate well on multiple levels. That's what I'll have to add, and I'll stop there.
Okay, thank you very much. Ruth, do you maybe want to come in and then we collect some further questions?
May I just add one thing?
Of course.
I would add the idea of culture of evaluation. We, in order to add to all those things that you have said, we discovered that for many stakeholders and also policymakers, evaluation was something understood as something external, as you said, and as the question said, very standardized, and also in order to point out what was being done wrongly. So this was very important because we need to change the idea of the culture of evaluation that is for learning. But for them, it's still something that is being done wrongly. They are spending the money doing things that are wrong. And that's for me, that's why I wanted to point out the idea of the culture of evaluation. We need to change the idea of what is evaluation for. And if we do that, we also can bring other stakeholders in. We can plan the evaluation since the beginning. we have done internal and qualitative evaluation. So for me, a key concept would be to the idea of the culture of evaluation, what that means for the stakeholders to do an evaluation. Yes, that. Thank you.
Thank you. And I think that's a really important point. And I think also speaks to the idea that stakeholders should be involved at every stage of the evaluation process. And that begins already with the planning, where you can discuss what kinds of tools you want to follow, for instance, discuss the relevance of particular tools. And maybe that helps to create, an understanding of what the evaluation is for, to jointly decide on an approach to it, rather than say, or confront stakeholders at a point when every basic decision is already made. Then it gets increasingly difficult to have people who trust the process and who are happy with the process. Okay, so we have two additional questions, and just a question to Ada. Is it possible for people to also speak up and explain a bit, maybe the context of their question? I think especially
Good afternoon, everybody. Yes, it is possible. If they raise their hand, I can pass on the microphone. Otherwise, it's not.
Okay,
so if they raise up their hands, I can pass the microphone and they can interact with you.
To Penelody, if you are willing to ask a question and maybe explain a little bit also the context of the country which you are talking about, and that I think would be very interesting to hear. Are you still with us? Okay, otherwise in Cameroon. Okay. Let me read out the two questions that we have still in the Q&A. So the first one, in my country, which is then Cameroon, it is very risky to monitor and evaluate in some areas due to violent practices. What other way can evaluation and monitoring be done to have adequate results? And then a second question by Hali Simsek. What needs to be considered when evaluating casework, secondary prevention, and awareness raising, primary prevention? Does someone want to react to those two questions, one of those two?
I think it's fitting if I respond to the Cameroon one since I work
there.
I
thought so too, yes.
Elodie, Elodie, I'm not sure where in Cameroon you're referring to, because there are 3 ongoing conflicts, as you are well aware, and each of them are different, and collecting data is very difficult in these contexts. And for me, I was geographically focused on the north of Cameroon, so Marawa, Garawa, Lake Chad Basin region. Collecting data for me was really working with the communities and understanding what was disturbing them and how best we can address those issues. The radio program that I managed basically went out and did a survey every week to find out how best to rebroadcast a program that would address those needs. And then the community would call in to air those grievances. Again, by airing those grievances, we felt it was a way that we could prevent violent extremism, so that way communities can discuss it. And a lot of the issues that we were dealing with was pastor agriculturalist issues, but then we also discovered through these ongoing dialogue with communities, sexual and gender-based violence, kidnapping, birth certificates or lack of birth certificate for youth. And we started addressing these issues one by one. So for me, there are ways to do it. We just have to tap into the right ones. I hope that answers your question. If it doesn't, I'm happy to provide further information.
Maybe I can add something to this. I don't have experience in Cameroon, but I worked on monitoring and evaluation in Sudan and in very remote areas of Sudan. And what we used there was remote monitoring. So we worked with phone surveys, which was very interesting. So basically we worked with a phone survey operator agency, and then they can send to all the randomized different phone numbers, they can send a few survey questions, and then people can reply even in the most remote areas. Obviously, there are limitations to it. Not everyone has a phone, and it's often, if people have a phone, it's often the male head of the household. So it's not 100% representative, of course, but it does give an opportunity to get some feedback from people in very remote areas that are hard to access, and also it's very anonymous. So it would reduce the risk for both the evaluator and the people being evaluated.
All right, thank you. Is there someone who would like to answer to Hallie's question?
Maybe I can go with that one. I'm not pretty sure that I have a clear answer for that, but it's true that this type of policies is a bit complicated to evaluate, because we are, as you say, in the secondary prevention, you have to some extent, to prove that people in risk has not became in more risks or gone too far. Is like crime. But we talk about crime prevention, we have to prove that these people is not doing something that was supposed to be doing. So it's a bit difficult to measure that. That's why in this policy, as we've been saying, it's very important to have the sense of the people and to see how the community, the stakeholders see the secondary prevention. We would never say that we have avoided or preventing something from happening, but is something more qualitative, that we are doing things that the community or the individuals thinks that are useful for them. So that could be the case for secondary prevention. And in terms of awareness raising, we can do. I think we can measure in this part. We can do something. We can do surveys, as some of the colleagues were saying, and yeah, in this case, I think we have more instrument. But the case of the case of secondary prevention is a bit more complicated. Only we have the sense of the stakeholders, the sense of the community, and how the actors involved seeing that the policy, perceive that the policy is working or not working in achieving the objectives of the program or the plan that we are developing.
If you want, I can also add something to that question. So I'm evaluating all the different projects for ICT, and ICT is a think tank who works on also raising awareness on a lot of issues related to radicalization and extremism, both for policymakers, but also for local communities. So I'm mainly involved in also then measuring, raising to what extent awareness has raised on certain topics among different target groups. And yeah, just some key considerations to that I use in my work is to always work with a pre and a post measurement, especially for awareness raising. So you need to know beforehand what the level of awareness was, and then be able to measure it towards the end. So that is I would say the basic rule of measuring awareness. And ideally, you want to come back to the same people again in different points in time through different interventions. So that's one. And it really helps to think through like the like the shared understanding. So what is it you want to raise awareness on? How do you want to do that? Why do you think? So what is important in a theory of change for raising awareness is that you know the mechanism, how you want to raise people's awareness. So why do you think your intervention X is going to raise this awareness? And then also test that through surveys. So why, like, what was most successful in helping people to raise their awareness on certain topics? So yeah, just some extra considerations there.
Okay, excellent. Thank you so much. I do not see any further questions. There are some comments in the chat. They are to thank you for your answers. So I think everyone seems satisfied with the responses that they received. That's very good, very encouraging. So we only have a few more minutes left in this session. So maybe as a final question to bring us back to where we started, the title of this session, as I mentioned in the beginning, is Evidence-Based Evaluation, a Key Step Forward for PCVE Policy and Practice. Now, I'm wondering what you think about this term and whether you believe that that this might help us to move evaluation forward, or whether you are at this stage still skeptical or confused about what this term means. I think that would be really interesting to hear. So maybe if you could just give a short indication of whether you think talking about evidence-based evaluation is relevant, is interesting, and perhaps so if interesting, then what in your mind the criteria conditions are for you that that would be particularly important. Is there someone, like one of you, who would like to answer that question?
Sure, I can go ahead. No, I definitely think it's a good term, and it's really, so if we look at, for instance, the theory of change, it's super important to build it obviously on external evidence. So that component, I think, can be very clearly integrated into the M&E approach and should also be a part of it. So I think it's really good to put extra focus on that. Then obviously the stakeholder values are really important because you want the evaluation to be relevant to the stakeholders. You want it to match what they need. Yeah, and finally, like the professional expertise is also key. So I think it combines actually the three key components of a good evaluation process. And it should be taken into account throughout all the different stages. So from design to implementation to final reporting. So yeah, I think definitely it's a very helpful term. I would also be interested in defining evidence more. Evidence is just like the beta disciplines are also often more prioritized than social science and humanities. I would be interested to see if there's a distinction in what is counted as evidence. Do we talk about statistical evidence, or can we also talk about more ethnographic, like accounts of people? Is evidence seen? How is it basically structured, and do all the different pieces of evidence get the same qualification? Those I think are very interesting debates. But yeah, I definitely think it's a helpful term, and it will help the field to progress.
Right. Thank you. And that question on what constitutes evidence is, of course, one we've been grappling with a fair bit. And evidence-based practice has that history of promoting experimental designs, right? Like, so there is that baggage that comes with it, and often it is still understood that way as a promotion of experimental or quasi-experimental research. What we're trying to do is to take a different stance, which is also becoming more popular across the disciplines, and that is to take a more inclusive approach and to basically very clearly express that all types of research have their qualities and should be ideally combined. Some types of research are very relevant in certain situations, but experimental and quasi-experimental design certainly are neither always feasible nor always useful. So we're very aware of that. So there's no promotion in our Indeed project of particular evaluation methods, but we sort of try to be as all-encompassing as possible. Ruth or Gatsby, would you like to comment as well?
Absolutely. I'll say something on this. First off, I think the fact that we're actually having a forum dedicated to improving the sector with M&E shows like that the sector and the people are dedicated to it. It really shows that we have a major interest in getting it right, not for ourselves, but for people that suffer from PVE and people that need to be helped. And in one of the earlier sessions, they talked about mental health. They talked about a lot of issues, well-being, and all the things about disinformation and misinformation that's on the rise that makes it even more difficult in this current context. So one thing I was thinking is in terms of the evidence-based practice, this lovely Venn diagram, I wonder if the external audience can also include communities, like the communities that we discuss with, or if that's what it's meant to represent. But that's also another aspect. And I really found, and I think this is important to stress, is that when we got community involvement and the community saying what was needed, what was not needed, what they benefited from, what they found no use for, really helped us to target those interventions to really address the root causes and the issues that they were suffering from. So this community-driven aspect of really involving all of the major stakeholders, whether it's the actual client, whether it's the donor, whether it's the technical expert or the community or any other actor in that process. I think it's quite important to move the needle forward, and the fact that we're all here giving ideas about how best to improve it is really reassuring. Thanks.
Hi, thank you very much. And yes, this is also something we've been discussing for a while, and we'll continue to discuss how to best involve stakeholders and what that means, who the key stakeholders are. So there we're still learning and also improving our understanding of this. And we basically try to look at this also very broadly. So by stakeholders, we do not only mean the people who are implementing a certain program, but also, ideally it should involve those who are affected by those programs to the extent possible. So there is a wide range of stakeholders which are relevant, and I think it's important to more systematically think through how they can be involved at different stages of the evaluation process, while still making the evaluation process then manageable and efficient at the same time, which is a balancing act. But this is something which is very important to us, right? Like to really think this through, and evaluations like the ones that you outlined are very inspiring in that regard, because they help us to understand what can be done. Ruth, for some final comments.
Thank you, Stefan. I think most of you all have shared most of the ideas about that. If I have to add something, for me, the concept of evidence-based evaluation has both sides, a bright side and a dark side, if you want to say. As you said, if we think on evidence as something like quantitative, very external, very formal, I would say that that evidence-based evaluation is not the good concept for what we are trying to do in PCVE. So that's a way to see that. But I think when the European Commission calls for evidence-based evaluation, it's not thinking on this methodological or theoretical part of evaluation, but more on something that give us an idea of what is happening really. Is not, for me, it's something, the bright side could be something to oppose evidence-based evaluation to something like political evaluation. Is not something that you can say, I'm doing very fine because I'm doing this, and this. Okay, but is that working well? Are you achieving your objectives? Could you do better or efficiently? So in that way, it could be that is the bright side, if you wanna say, of the of this type of this concept of evidence-based evaluation.
Thank you so much. Yes, and I think you again speak. What is very important, I think, is that we explain well what we mean by the term, because it has this baggage, right? It has baggage in two separate ways, perhaps. One, this association with the promotion of particular types of evaluation methods, and that's a problem. If people associate this immediately with randomized control trials and that's all that matters and is important, then we have a problem. And the second association, I think, is equally problematic, which is that evidence-based evaluation is about research first, right? And not necessarily about stakeholder involvement, or that's not usually what is immediately associated with. So I think to get that type of definition out there, which now is also generally accepted by many disciplines, then we are a big step forward, and we can probably also use it in a very productive way. And hopefully this is also the way it is received in the way it catches on. But that's that is of course to be seen. Thank you so much for this very interesting discussion. It was very, very nice to have you in this panel. I hope we have now also no more questions left. I think that looks good. All right. I wish you all a really nice afternoon still, and a lovely conference ahead. And I will see you soon. Thank you very much. Bye-bye.
Thanks all, a pleasure.
Bye, everybody. Thanks so much.